welcome to the item, and this is item number D101, and it's the Dementia Interpreters Course by Training to Care. Now, my name's Glenn Knight, CEO of Training to Care Group, and you may know me from amazing courses such as the Virtual Dementia Tour and also the Autism Reality Experience. But today we're here to talk about the brand new Dementia Interpreters Course. Now, I created this for a very, very simple reason. Communication around dementia is at the heart of everything we do, and care providers need to start to recognise that we need to learn the language of dementia and translate this language of dementia to really reconnect with the people that we support. Now, the video is going to be actually delivered by Michael Peachy, who's our lead trainer. So I'm going to hand over to Michael, and he's going to tell you all about this inspiring and most important course.
Hello, and my name is Michael. Thank you so much for joining me today. I'm here to talk to you about the Dementia Interpreters Course. This course is different to most of the other courses that you will have booked with us before and other courses that you've been on yourself before. The course itself is all about communication and dementia. And this is something that we've not focused on enough in the past. And to be quite honest, training has not provided an effective solution for. I've been a trainer myself for over 8 years now, and I've been working in the social care sector for over 13 years. And I've been on dozens of communication training sessions, and I've delivered dozens of them myself. And most of the time, it's very generic. You'll go along to one of these sessions, you'll be told communication is more than just talking, off you go. And the problem with that is, you then find yourself in situations with people living with dementia where you don't know what they are communicating, where you are not able to communicate with them in a way that they can understand. So that training is not fit for purpose. And that is one of the big reasons why we put together this Dementia Interpreters Course. Communication is at the heart of everything that we do. And if it's not effective, we're not able to support people in the way that they deserve to be supported. And that's what we're going to look at with the Dementia Interpreters Course. Specifically, how people living with dementia communicate and how we can communicate with them to provide them with the care that they deserve. Now, I want you to take 2 seconds for me and just think about this little scenario. I want you to imagine that you are living in a care home where nobody speaks your language, where you cannot speak the language of anybody providing you with support. I want you to take 2 seconds to think about how you might feel. Now, I'm assuming all of those thoughts that are running through your head are negative. I'm guessing you would feel lost, lonely, frustrated, confused, embarrassed, angry. Probably, most of you might be thinking about giving up, about not trying to communicate with anyone, knowing that it's not going to work. Now, unfortunately, this could be the reality for thousands and thousands of people living with dementia, living in environments where people don't know how they communicate and are not able to communicate with them in an effective way. And we have to do something about this. We can't expect people to live their lives feeling these negative emotions. And they don't have to, as long as we know what to look out for and the skills and the techniques to use. And that's where the Dementia Interpreters Course comes in. During the course, you will learn dozens of different ways that people living with dementia communicate. You will learn to recognise them. You will learn what they mean and how to respond to them. And then by putting those skills into practice, you can ensure that the people you support won't feel all of those negative emotions that you were just thinking about. Now, this leads us on to the next challenge that we face with communication and dementia. I've delivered thousands of dementia training courses over the years. And I tend to start those courses by asking people to tell me what they think of when they hear the word dementia. And there's some common things that tend to come out. The first one is memory loss. Yes, memory loss. The second one is aggression. No, dementia does not make you aggressive. It may make you lonely. It may make you scared. And your way of communicating that may be through an action that I deem to be aggressive. But because we don't recognise that as a form of communication, unfortunately what people end up doing is they end up labelling people as challenging, as difficult, as awkward, as aggressive, which is wrong. And the other thing that people tend to tell me on these courses is that people living with dementia, people that they support, struggle to communicate. The amount of times I've had people tell me that I support somebody living with dementia and they can't communicate. That's wrong. We never stop communicating. From the very first breath we take, we are communicating with the world. That first breath, that first cry is letting people know, I'm here, I'm okay. The very last breath we take, I'm telling everybody I'm here. Even after that last breath I've taken, I'm still communicating with the outside world. I'm letting people know that I'm not here anymore. And that whole journey, every single minute in between those 2 points in our lives, we are continually communicating with ourselves in the outside world. But we're not trained to recognise that. And that is crucially important when we're supporting somebody living with dementia. We need to recognise the hundreds, the thousands of different forms of communication we use. To be able to pick up how people are feeling. If we can pick up how people are feeling, we can work out what their unmet needs may be at that moment in time and make simple changes to the care, to the support that they receive to make a transformational difference to their quality of lives. That is what we do on the Dementia Interpreter Course. The next step is about us delivering the training in a way that leads to impactful change out on the floor, out in people's own homes, and improves communication. And this has always been the trickiest bit of delivering training. You might attend a 3-hour training session with me and have an amazing time. And if I'm delivering the training, I'm sure you would have an amazing time. The problem is when you leave that session, life takes over, work takes over, and the things that have been discussed in that training session can quickly become forgotten. And if we forget what we've talked about on the training session, how are we ever going to improve and change our practice? And that's a huge challenge for us with our training courses. We don't want training courses to be tick box exercise. We want them to lead to improvements. And the way that we have done that with the Dementia Interpreters Course is by making it an experiential training session. Rather than you coming along for 3 hours and listening to me talk and joining in with conversations, you will use various pieces of equipment which will give you the same barriers to communication that people living with dementia may experience as well. So you will feel what it might be like for your loved ones, for the people you support. You will see the effects that these barriers can have on your colleagues, on your friends, on other delegates on the course. And that will stick with you. You will never ever forget how it felt when you were in their shoes. For any of you that have ever done the virtual dementia tour before, you know that this training works. I've spoken to people that have done experiential training with us 6 years ago, 7 years ago, 8 years ago, and they can still tell me exactly how they felt, exactly what they did. That's the effect that training needs to have to lead to transformational change in the care and support we're able to provide to people. And what I'm going to do in a second is show you some of the equipment that we use on the training course. Before I do, I want you to have a little think about something else for me. We mentioned a couple of minutes ago that a lot of people think that somebody living with dementia finds it difficult to communicate, and a lot of people might get to a point where they're unable to communicate. Now, I'm going to argue that. Imagine for me that you have been in a car accident and you've ended up with a broken jaw and you're lying in your hospital bed and you want to let your doctors know that you're in pain. How would you communicate that to them with your jaw wired shut? I bet a lot of you right now are saying, I'd write it down. And that's exactly what I would do as well. Write them a little note, pass it over to them, there we go. You've communicated you're in pain. But that accident you were in, you didn't just break your jaw, you've broken both of your arms as well. You can't write that note now. So how are you going to communicate to your doctors that you're in pain? Now you can't speak, and now you can't write a note. Some of you might make noises. Some of you might try and gesture to where you're in pain. So we've just proven that communication never stops. And that's what this course is going to teach you. By putting you in the shoes of people living with dementia, you are going to experience barriers and experience how those barriers don't stop you from communicating. It just means your communication is happening in a different way. So next, I'm going to show you the different pieces of equipment we use on the Dementia Interpreter course. I'm going to explain to you how they relate to people living with dementia and what they might be experiencing themselves. And we're going to chat about what you will learn, what you will be able to take away, what you will be able to use to reconnect with people living with dementia. The first practical activity we do involves one of these. Now this is a mouthpiece or a mouth guard, and we will use these to impair your ability to speak. Now, a lot of people living with dementia may have a condition known as aphasia, and aphasia affects our ability to communicate. Now most people might recognise aphasia, and they might recognise it as a condition that affects a people's ability to speak, and that's true. A lot of people living with aphasia may find it hard to find certain words. They may develop a stammer. They might talk very slowly or very quickly. But aphasia can also affect people in other ways. It can affect your ability to read and to write. On the course, we're looking at people's ability to speak. And by using these mouthpieces, it's going to make it a little bit tricky to speak as you normally would. Now, how this would work on one of our sessions, everybody in the group would be given one of these mouthpieces. These mouthpieces are all sterilised and cleaned before the training session, so there's nothing to worry about there. As well as getting one of these little mouthpieces, everybody is given one of these cards as well. Now, these cards have statements on them, and the activity is very simple. You can probably guess what we do. One at a time, people will put their mouthpiece in, they will look at their card and communicate what is on their card to their colleagues that they are working with. Now, the easiest way for me to explain how this works is for me to show you the activity. So I am going to pop my mouthpiece in, I'm going to communicate to you what is on my card, and I want you to see if you can figure out what it is that I'm trying to communicate to you. So, here we go. Any ideas? I'm going to guess probably not. Let me try again. I bet you recognised that I was singing Twinkle Twinkle Little Star, and you would be right. And I bet you recognised that from the tune that I was singing and not the words that I was saying. Now this is really interesting. Normally, if you gave me a card and asked me to communicate what's written on this card to you, I would tell you by speaking out the words that were on the card. But this time, I couldn't do that because I was experiencing a barrier with speech. So I've naturally adapted and I've sung the tune in the hope that you would recognise the tune and know what I was trying to communicate. And this is proving the point that we discussed earlier on. Communication never stops. You just experience barriers and find new ways of working around those barriers to communicate what you need to other people. And that's just what happens with people living with dementia. That's just what happens with anybody living with some form of cognitive impairment. It's just what happens with any human being. Now there's something else that's very, very interesting with this first activity that we do as well. Quite a lot of the time, people living or experiencing barriers with communication are going to be experiencing emotions as a result of this. And we can be a little bit lax at recognising what these emotions might be and how they may be affecting people. If I was to ask all of you, how would you feel if you were communicating wearing one of these mouthpieces? You'd probably say frustrated, especially if you're not able to communicate what's written on your card straight away and you had to try again and again and again and again. And you'd be right. And we've all probably seen somebody living with a communication barrier that has become frustrated. But there's so many more emotions that people may experience that we just don't recognise. And it's not until you're in that position yourself that you start to realise what these might be. For example, I must have delivered over 1,000 of these courses. And every single course I've done, at least one person in the room has felt a little bit embarrassed, a little bit silly, a little bit self-conscious when they've been wearing one of these mouthpieces and trying to communicate. And this is perfectly understandable. I definitely feel a little bit silly when I'm communicating with that in my mouth. But when we stop and think about it, let's say you know somebody living with dementia. Let's say they have aphasia and they're finding it difficult to communicate verbally. Do you think there's a chance that they might feel a little bit self-conscious? That they might feel a little bit silly? Of course there is. But honestly, thinking back to all of the years when I worked out on the floor in care homes supporting people living with dementia, I can't remember a single time when I ever looked at somebody and thought, maybe you feel a little bit self-conscious, maybe you feel a little bit under pressure, because I wasn't trying to recognise it. I wasn't looking out for it. When you do this first little activity, and when we talk about it after, we'll talk about the different ways that people have communicated the different emotions they were feeling. So for example, using our example that we were just talking about somebody feeling self-conscious, somebody might have communicated that by blushing, by covering their mouth when they were talking, by their shoulders being raised. That's a form of communication. They're telling us how they feel through their natural reactions. And that's what we need to take and apply when we're supporting people living with dementia. If I can go back to the people I support and start looking out for these little signs, I might see that my mum is telling me she feels self-conscious. If I recognise that, the next step is, what can I do about it to make it feel more comfortable for her? Maybe that's not having conversations where all of the other family are involved. That might make her feel better. But unless we recognise that initial emotion, we're never going to be able to make adaptations and changes to improve her quality of life. It's such a simple activity, but it's so powerful when you start digging into all of the emotions that everybody experiences when they do it. And my favourite part about this first activity and the Dementia Interpreters Course as a whole is those light bulb moments that people have. Somebody will mention, I felt this. You'll then have two other people sitting there who look at each other and go, maybe that's why Joan is doing this. Maybe that's why Albert is doing this. And that makes my job as a trainer incredibly easy. I'm guiding a conversation by feeling and experiencing what it might be like for the people that they know. All of the delegates that attend the training will straight away be able to pick up and recognise new ways that the people they support have been communicating to them for years, but they've never recognised. It really is such a powerful activity. And these two themes that we've just talked about here. So the different forms of communication that people will use. Not just the singing, but the changes in people's body language, the emotions that people are experiencing. We look at these throughout the practical course. And we build our toolbox, our library of different forms of communication, what to look out for and what they might mean. So let's have a look at the second activity that we do. And at this point in the course, what we do is certain people on the course, certain delegates will become our people in care. And they will get some extra activities to do and some extra equipment to use throughout the remainder of the course. And on this second activity, what they will be given is a pair of these goggles. Now, these goggles are all frosted up. So you can see shapes, you can see colours, but you can't see any details. And we know that pretty much everybody living with dementia will experience a change with how they see the world. Now, that could be for many different reasons. That could be linked into damage within their brain. That could be linked into an eye condition that they are living with. It may simply just be down to natural ageing of the eyes. But the fact is, if people live long enough, they will see the world differently. And that's what we're representing with these goggles. Very simple. Person in care are given another card. They're asked to memorise this card and then put on the goggles and the mouthpiece. We do highlight on the training course, it's very important that the people in care memorise their card before they put their goggles on, because it's going to be quite tricky to read with these on. You would be surprised at the amount of people that don't do that and are sitting there trying to read their card with these on. Hasn't worked once yet. But anyway, as soon as our person in care begins to communicate, we ask everybody they're communicating with to busy themselves. And that could involve simply standing up and moving around. And you can imagine, for somebody that is experiencing visual impairment and they're trying to communicate and they've got all of these shapes moving around them, for a lot of people that can cause a lot of negative emotions to be felt. This is a hugely important part of becoming a dementia interpreter. We need to ensure that if somebody is trying to communicate with us, we give them the focus and the attention that they need. The problem is, when we're out there, when we're working, when we're at home, when life is going on, it can be very difficult to always make sure that we're doing that. The problem is, if we don't, it could trigger some negative emotions, and also we're not going to pick up exactly what somebody is communicating to us. Now, the big outcome that we want to achieve from this activity, as well as all of the new ways that people are communicating, as well as all of the new emotions that we're picking up on and how they're being communicated, is we need people to leave knowing exactly how important it is to focus and pay attention, but then also to go out and do that. Now, the challenge that we have on training, as we've already mentioned, is a lot of the time what is talked about on training doesn't always translate to the real world. And I must have mentioned on countless training sessions about the importance of giving people time and attention and focus. And I know that people haven't always gone away and put that into practice, not because they're bad people, because there's so much else going on around them, it can be difficult to do that. We've managed to deliver this part of the training in a way that has led to people making this simple but hugely challenging change. One of the very first dementia interpreter training sessions I delivered after the first lockdown last year was to a care provider down in Surrey. And we delivered this via webinar. I called the home up a couple of days later to speak to their dementia lead to see how the training went, to see if they had any advice, any feedback for us, because it was all still new back at the time. And I heard that all of the delegates that had been on the session in the morning had left that session, and in the afternoon they'd been seen sitting down and talking to people. And I couldn't believe this, because I spent years trying to get people to do this, but I'd never been able to find a way to actually make it happen. The dementia lead then said to me that she was having to shoo them along because they were busy. And I was going, no, please don't do that. It's such an important part of the course. And she promised me she wouldn't do it. Now, there were 2 residents in that home that were on medication because the staff could not manage their behaviour, that now aren't. And a really, really big reason for that may well be that people are now giving them that time, that focus, that attention that they need. And the only way that we were able to achieve that change was by putting delegates into the shoes of the people they were supporting, was by shocking them into feeling exactly what it must be like. So we're continuing to build this library of new forms of communication. We're continuing to build that toolbox of new approaches to use based on what we're seeing and what we're recognising. And it gets even better. We've got another 2 activities to go where we will give delegates even further barriers to communication to continue truly learning and understanding how people living with dementia may communicate. So let's have a look at the 3rd practical activity we do on the Dementia Interpreters course. You might have a good idea where we're starting to go now. So this 3rd activity, our people in care will wear their mouthpiece again. They will wear their goggles again. And this time we introduce a 3rd piece of equipment. And this 3rd piece of equipment is a set of headphones. Now, these headphones will play static, they play white noise. That's not what it's like to live with dementia. However, we know that people living with dementia will hear the world differently. Anyone that's done the virtual dementia tour will have heard what it might be like to live with dementia and what it might sound like to live with dementia. And that's what these headphones replicate, that same barrier. Similar to before, our people in care are given another card with a statement on it. They're asked to communicate it to their colleagues. Their colleagues this time, rather than moving around and busying themselves, what we actually do is we switch people around. So up until this point, they've been working with 2 or 3 colleagues. We're going to change that. And rather than working with the same people they have been the whole way through, they will now have 2 or 3 new people that they're communicating with. And this is fascinating to watch. With the goggles on, they won't be able to work out exactly who that person is. They won't be able to see facial details, but they will know it's somebody different. It's somebody taller. It's somebody with a different coloured top on. And this can create a huge additional barrier to communication. All too often, when we're supporting somebody living with dementia, we focus purely on knowing as much about that person as we possibly can. And that is hugely important. What we don't focus on enough is whether that person knows us. And that's what we replicate in this 3rd activity. They are now communicating with people and they're not exactly sure who they are. This is a huge additional barrier to communication. If you're communicating with someone that you don't trust, that you don't feel confident with, it creates some huge problems for us. All of the skills that we've developed on the course so far, all of the new forms of communication we are learning to recognise, all of that is going to mean nothing if we don't have a good 2-way relationship with the person we're trying to communicate with. And that's what communication is. It's a 2-way relationship. So we start delving into depth about how we can let that person know who we are. And when I'm talking about letting them know who we are, I don't need somebody to know that my name is Michael. What I need them to know is when they look at me, they know I'm trustworthy. When they look at me, they know I'm there to support them and help them. There is so much more we can do around that we aren't doing at the moment. And without doing that, all of the learning that we do on the course is going to be very, very, very difficult to put that into practice. On this 3rd activity, we've learnt the importance of building this 2-way relationship, as well as continuing to recognise dozens of new forms of communication that delegates are showing. The 4th activity will put all of the learning that we've done on the course so far into practice. And if delegates have not learned as we've gone through, if they've not picked up on all these new ways of communication that we've been talking about, if they've not picked up on how to recognise specific emotions and how to manage them, then this 4th activity is going to be very, very difficult for them to understand what their colleagues are communicating, and virtually impossible for them to support them in the right way. The 4th and final activity then What we do on this, our people in care will wear their mouthpiece. They will wear their goggles. They will wear their headsets. And we've got one additional piece of equipment that we will ask them to wear this time. I'm wondering whether you can take a guess at what this might be. So far we've impaired speech, we've impaired sight, we've impaired hearing. What else do you think we could impair? I think some of you might have guessed this. With this fourth activity, we will impair people's ability to move. And we do that with these jackets. Now, these jackets that we've got will impair people's ability to move and to gesture. They are basically straitjackets that we are putting people in here. And this last activity is absolutely fascinating. And I think there's two very, very interesting points to this last activity. The first one is, it's almost like we're taking people through a journey of dementia. We're starting off with people experiencing changes with how they speak. And then we're moving through and people are experiencing challenges with sight, with hearing, and then finally with mobility. And a lot of people that we support, if they live long enough, especially in more advanced stages of dementia, will experience problems with mobility. And you'll have a lot of people that end up spending a lot more time in bed. A lot of people that I've supported have been in positions where they've not been able to move and not been able to gesture. And it's incredibly important that we're able to pick up on that. The problem that we have is that if somebody can't speak in a way I understand, if somebody can't move and gesture, it's going to be very difficult for me to be able to pick up on that. And this is the stage where a lot of people may say that people aren't able to communicate, which is wrong. And that's what we will look at on this final activity. The second reason why I think this is a very, very interesting activity, it's almost an assessment of all the learning that we've done in the training. If people haven't learned all the different styles of communication, if they haven't been able to recognise different emotions that people feel, when they get to this last activity, they're going to find it very challenging, if not impossible, to understand what their colleagues are communicating to them. Now, let me give you an example of how this last activity works. And this was a course I delivered a couple of months ago now. And our person in care was a young guy, early 20s. And the whole way through, when he was wearing his goggles, when he was wearing his headphones, it was very chilled out, very laid back. And the last activity, when we put the jacket on him, he changed. He changed. And when I'm saying he changed, he didn't start panicking. He didn't start calling out. He sat up in his chair ever so slightly. You're talking maybe an inch higher in his chair than he was before. And I spotted that and I thought, that's interesting. Need to have a little chat about that. I asked his colleagues after whether they noticed anything different about him on that last activity. And they said, I noticed he was sitting a little bit higher in his chair. Fantastic. I spotted that as well. So what do you guys think that meant? And they sat there and they thought about it. And they went, I think he was trying this time. I think he didn't like the jacket and he was putting in a bit of effort. So we asked him and he said, yeah, I hated that jacket. It was really hot and I wanted it off. So what they'd been able to pick up on was that the height he was sitting at in his chair was a form of communication. Now that might sound really small, really silly to you. Let me put this into a bit of perspective. Before we do all of this practical stuff, I'll ask the generic communication training question. Imagine you can't speak. Give me 10 different ways you can communicate. And normally people come up with 5, 6, 7 different examples, and then they start to get a little bit stuck. The delegates on this course were able to look at the height somebody was sitting at in the chair and recognise it as a form of communication. Now that's proper communication. That's what it takes to be a dementia interpreter. We need to get away from this and we need to start using these. There's that old saying, we've got 2 of these and 1 of these, but we've also got 2 of these. We know we communicate more through our bodies than through this. So why don't we use these when we're communicating with people? That's what we need to do when we're supporting people living with dementia. We can't achieve these changes just by talking to people. We need to put people in that position, in the shoes of the people they know, their loved ones, the people they support, to get them to recognise this, to realise all of the different forms of communication that up until now they've been missing. And at the end of the day, what we're trying to do is we're trying to get people to learn the language of dementia. That's what we achieve through this course. And if you think the course is amazing, we're just getting started. A huge way that people living with dementia will communicate, and a huge way that we all communicate, is through our behaviours and through our actions, through what we do every second of every day. We're doing those things for a reason, and it's telling other people something about us if we can recognise it and interpret it correctly. And we tap into this a little bit on the training, but only a little bit. This links into a much bigger project that we are running, and that is the Dementia Dictionary. The Interpreters Course has the ability to change the care that people are receiving. The Dementia Dictionary, in conjunction with the Dementia Interpreters Course, has the ability to change the world. So what I'm going to do next, I'm going to show you the Dementia Dictionary. I'm going to explain to you how it works. I'm going to explain to you how it links into the Dementia Interpreters Training. And most importantly, I'm going to tell you the opportunity that you have. That if you get involved with this, if you book the Dementia Interpreters Course, not only are people going to experience an incredible life-changing communication course, they're going to get involved in a project which can change the world for people living with dementia. Right, let's have a look at the Dementia Dictionary then. Now, the Dementia Dictionary is a free-to-use online resource that anybody in the world can access. And it's all about getting people to learn the language of dementia and building on what we've already talked about with the Dementia Interpreters Course. Let's say you see a situation that you don't understand. You've got no idea why it's happening. You've got no idea what it means. You can go to the Dementia Dictionary and get a list of different reasons about why these might be happening, about what these behaviours, actions and vocalisations might mean, a list of interpretations. We're trying to get people to learn the language of dementia. And what we're trying to do, we're trying to change people's way of thinking about behaviours and actions. What we tend to do at the minute is we see something that's difficult to manage, difficult to deal with, and we label people. We say they're being challenging. We say they're being aggressive. We look at these situations as challenging behaviours, which is wrong. We need to look at negative behaviours and change them into positive forms of communication, because that's exactly what they are. Every time somebody is doing something, they're communicating to us how they're feeling, what they might need at that moment in time. The dictionary is going to be your go-to resource to figure out these situations that you currently don't understand. Now, the easiest way to explain the dictionary is to show you how it works. So you can see here, this is the homepage for the Dementia Dictionary. Now, this is what it looks like on a web browser. Excitingly, the Dementia Dictionary is now free to download and use as an app. And you can download this from the Play Store or the App Store, wherever you normally download your apps from. On the app, it will look slightly different to what it does on the web browser, but it works in exactly the same way. So let's say you're dealing with a situation that you don't understand and you'd like an interpretation about that action, that behaviour, to understand what that person is trying to tell you through their behaviours. All you do on the dictionary is head to the main dictionary page. Here you will find a search engine and you're able to search for the behaviour that you're seeing. Now, the example I always use when I'm showing people the Dementia Dictionary is somebody hiding their hearing aid. This is a very, very, very common behaviour that you will tend to see from people living in their own home or living in a communal care setting. They'll take the hearing aid out, they'll put it down somewhere unexpected, and it will go missing. And it can turn up in the strangest of places. And it can be really difficult to understand why people might be doing this. The Dementia Dictionary will be able to give you some ideas and some interpretations about why people may be doing this. So all you would do, very simply, is go to the search bar and type in hearing aid, if that's the behaviour that you're looking for. That will then search the entire Dementia Dictionary, and you will see any results that match what you've searched for. You're then able to work your way through the search results until you can find something that sounds similar to the situation that you're seeing yourself. So based on the situation that we've just described there, the very first result that we've got on there looks very similar to what we're talking about. So somebody's mum keeps misplacing their hearing aid. That looks similar to what I'm dealing with. You can click on that and open it up. And then you will see here at the top, we've got a little bit more information about this particular behaviour. So the information we've got on here, this is somebody's mum, keeps losing her hearing aid. When they're finding it in strange places. So the example on there is flower pots. That sounds similar to what I'm seeing. So underneath that, you've got a definition. And this definition here is basically saying maybe the hearing aid is uncomfortable. Now you might look at that. You might then look at mum's ear and you might go, do you know, there's a little sore there. That could be why she's doing this. You might also look at that and go, no, that's not why this is happening in my situation. So what you're then able to do is keep looking through for any other definitions that we've got in the dictionary for that particular behaviour. So here we have another one. The second one is saying it's an auditory processing issue. So maybe this person is taking out the hearing aid because the environment is too noisy, it's too loud. Right, this keeps happening with this person that I know when there's lots of people around. This keeps happening in communal areas. That makes sense. Once again, you might look at that and go, no, that's not why this is happening in my situation. So you can keep going through, and we've got a third definition on this one. This definition is slightly different. It's talking about the colour of the hearing aid. So maybe this person isn't taking it out on purpose and losing it. Maybe they're just taking it out, putting it down, and are not able to see it again because it doesn't stand out. Now, if none of those definitions that we've got in the dictionary fit the situation that you're dealing with, you're then able to ask for a specific interpretation of your specific situation. And you would do that by going back to the main search page, and underneath you can click on Ask a Question to be Interpreted, which will bring up this page that you can see here. And very, very simple. You can put in a little title of your question. You can then add as much information as you want to and as you possibly can to enable people to start coming up with interpretations for that situation that you're seeing. Now, the really exciting bit about this is anybody in the world can access this right now and start using it. And I'm going to show you another little part of this site in a second, which is not open to everybody in the world, which will explain to you how we come up with our interpretations. As we've discussed, anybody in the world can access the dictionary and use all of the definitions in the dictionary to better understand the people they know living with dementia and to help them learn the language of dementia. However, so far, I've only showed you the part of the site that's open to the general public. The next part I'm going to show you is just for people that have attended and completed the Dementia Interpreters Course. When you complete your Dementia Interpreters training, you become a registered dementia interpreter, and you will have the option of registering on the Dementia Dictionary as a registered dementia interpreter. And that enables you to get involved with the Dementia Dictionary project. You will then have the opportunity to get involved in conversations, coming up with interpretations for the thousands and thousands of behaviours we are being asked for interpretations on. So I'm going to show you how this works. This page here, like I said, anybody can ask for an interpretation of a behaviour on there. They submit that, and then all of our interpreters that are registered then get involved in these conversations. But where do they do that? Now, up the top of the page here, you can see there's the Interpreter Forum. If I open the Interpreter Forum, this is the main hub, the main engine of the Dementia Dictionary. Every single behaviour, every single action, every single vocalisation that somebody would like interpreting will show up in the forum. And as you can see, there are hundreds and hundreds and hundreds of different conversations we've got going in here. The really exciting part about this site, we only launched this 8 months ago, and already we are seeing hundreds of people asking for help and thousands of people getting involved with the project. So it's going to be really exciting over the next year, over the next 2 years, over the next 10 years to see how big this gets. Let me give you an example of how a registered dementia interpreter would use the site. So they are able to scroll through the forum till they find a behaviour that they've seen themselves, that they've come across before. They can also, if they choose to, search for different situations, search for different behaviours. Now, I'm going to have a little look for food, because food's a very important subject to most of us, and a lot of the challenging situations we see involve food and occur around meal times. On here, gone off food. Anybody that's got any experience supporting somebody living with dementia or any form of cognitive impairment has probably had situations where they've had people who haven't been very keen to eat food, who don't appear to have a very big appetite. So I've got experience around that. Let's have a little look. Now, up the top here, you've got your definition of the behaviour, a little bit more information about what the people are dealing with. So this situation we've got on here, this is somebody's mum who's really gone off her food. It says in there she used to eat a lot, now there's times where she won't even touch her food. Based on my experience, I've come across this quite a lot. So I might decide I can help here. And if we scroll down, you can see here up the top, this first interpretation, number 1. So this was Alex. And she's gone on and she's put an interpretation for that behaviour. And her interpretation is basically, this person is telling you, the food doesn't taste any good. That's why I'm not eating much. And she's explained on here as well why that might be the case. So just naturally as we age, as Alex says here, our taste buds will change. We'll have less taste buds the older we get. And especially with certain forms of dementia, that can have a huge effect on how we taste food as well. Now, I might read Alex's interpretation there and go, that makes a lot of sense to me. I agree with that. What I can then do is I can give it a little vote. So you can see here, this particular interpretation has received 8 votes. The more popular the interpretation, the more likely it is to be added into the Dementia Dictionary. So this one that Alex posted here, it got 8 votes, and then it was decided by the community that's going to be added into the Dementia Dictionary. And you can see up the top here, we've got a definition. Alex's interpretation has now become a defined interpretation. And that's how we build the Dementia Dictionary. Everything that happens in this forum is completely hidden from everyone in the world until it's added into the Dementia Dictionary. And this is really important. We need a safe space where we can have discussions. We need a safe space where we can throw out our opinions and our ideas and share our experiences without the fear of other people coming back at us negatively about that. And the Interpreter Forum allows us to do that. There's another reason why the forum is all hidden from the general public as well. At the moment, if you're dealing with a situation and you've got no idea why it's happening, there's nothing stopping you going to Google and searching for that behaviour, and you will get millions of results coming up. That's problematic for a few different reasons. The first reason is there's a million different results there that you have to work your way through. Chances are it's going to be very hard to find one that matches the situation you're looking for. The other problem you're going to have is that information is not always the most reliable. There is a lot of outdated ideas, a lot of dangerous information that's out there. Having the Interpreter Forum close to the public is basically a bit of quality control. Anyone who has access to this has done the Dementia Interpreters Course in one form or another. So we know, they know what they're looking out for. And together as a community, we've got hundreds and thousands of people who all know what they're doing. Everybody on this forum has some kind of first-hand experience with people living with dementia. That may be by being a care professional. That may be through being a health professional. That may be through supporting a loved one who's lived with dementia, or working in the community with people living with dementia, or coming into contact with people living with dementia in their daily life. And this is the part that really gets me excited about the dictionary, Because everyone in here has done the training, because everyone in here has got some understanding and some experience with dementia, everything that's being posted in here is based on first-hand experience. This is people saying, I've done this before, I've seen this before, this is what I've done to remedy that situation. And this is hugely important. At the moment, a lot of the advice we get is from academics who might not have much experience supporting people living with dementia. A lot of the strategies that are put in place come from politicians who might have very limited knowledge or understanding about dementia, amongst other things. This is from the real experts. This is from people that have got real experiences and they need to share them with other people, because we're terrible at sharing good experiences. My own personal experience in care is that we're very, very good at telling people when there's a problem or when something's not being done. We're terrible at telling people when we've done a great job. And 99% of the work that gets done is amazing. The Interpreter Forum gives people a platform to share all of these incredible success stories. Let's say you've looked at Alex's interpretation there and you've said, that sounds great, but I've got a different experience, I've got a different idea. You can add your own interpretation on there. So we've got Samantha here who's added her interpretation. We've got Jane who's added one. Maxine, Sergit, Matthew. It's all people sharing their ideas. And the same process that we discussed will work for all these other interpretations, so people can give these votes, and then eventually a lot more of these are going to end up in the dictionary as well. Not only can you vote for interpretations that are on there, but you can leave replies and comments. So you can get involved in conversations about communication. So what we're doing is we are communicating to better understand how people living with dementia communicate. It's so simple and so easy to do. Like I said, this is all hidden from the general public. The only people that will get access to this are people that have done the training, whether that is the e-learning, whether that is a webinar version of the Interpreters Course, or whether that's a face-to-face interpreters training session. So we know everybody in here is committed to making the world a better place for people living with dementia. And this is just the start. As registered dementia interpreters, you will get access to so many amazing opportunities. You will be able to make real change to the care experienced by people living with dementia. For example, when you first register on the Dementia Dictionary, you will be registered as a level 1 dementia interpreter. So everybody that does the training becomes a level 1 dementia interpreter. There are 5 different levels that you can achieve. And those levels are there for 2 really important reasons. Reason number 1, they're there to encourage people to get involved and participate, because this only works if we as a community all get involved with this. It's no good me being the only person sharing my ideas, because I only know a tiny little bit based on my own experience. So the levels are going to help to encourage people to keep coming back and contributing. The second reason we've got the levels in there are to recognise people for their contributions and to recognise them for the effort that they're putting into this. This is another huge problem we have in health and social care. Quite a lot of the time, people are very, very quick to point the finger at us, and there's a lot of bad press around about social care. But anybody that's got any dealings with social care knows that there's some incredible people working in the industry. There's incredible work being done. And not only in the industry itself, if you're an unpaid carer, if you're supporting a loved one, a family member, a friend, you're doing amazing work as well. But you never get the recognition you deserve. The levels will do that for you. As you work your way through the levels, we will give you the recognition that you deserve. Now that could be done through certificates for reaching certain milestones, because everybody loves a certificate. Even more than certificates, people absolutely love badges. And when you reach level 3, you will be sent one of these dementia interpreter badges. So everybody that you come into contact with will know that you know what you're talking about. There are other opportunities down the line as well. So there's going to be opportunities to get involved with research projects with the universities. There's opportunities to get involved with bits on social media to change people's perceptions about dementia and change from these negative perceptions that people tend to have to positive perceptions, where people can realise that somebody living with dementia is still able to live a happy, purposeful, fulfilling life. There are going to be further opportunities down the line as well, because we're just getting started with this. And you're going to have access to all of this for free. There are going to be no extra costs for you working your way through these levels. When you get to level 4, there'll be a further advanced Dementia Interpreters course that you can do. And that's the only part of the pathway where there's only charge. £60 per person to access that course. That course is being designed in conjunction with a world-renowned dementia specialist in America. So you really will get access to the most amazing opportunities, whilst at the same time making a transformational difference to how people view, perceive and understand communication with people living with dementia. And that's not all. As well as having access to all of these amazing opportunities by working your way through the different levels, you're also going to receive free further learning. Each time you achieve a new level, you will be sent 3 further modules about specific areas and communication. So this is completely free learning for you. The modules that you're sent are not obligatory. You don't have to do them. They're there for you if you want them. But who doesn't want extra information about specific areas of communication? For example, we've got modules around food and how food communicates with people. We've got modules around the environment and how specific things in the environment can better communicate with people. The very first module you'll receive, which will be waiting for you in your inbox when you finish your interpreter's course, is all about advanced care planning. Now, advanced care planning is hugely important and also something that not enough people do. It's very hard to think about the future and maybe needing some care or support in the future. And what a lot of us tend to do, we either go, well, it's not something I need to think about now, so we put it off, or that's quite scary thinking about it, so I'd rather not. The fact that it's scary to think about, or the fact that we don't think we need to think about it just yet, doesn't mean that we don't. It's critically important we do. And if we can get more people being aware of advanced care planning and putting down in black and white who they are as people, what is important to them, this is going to make a huge change to the care and support they will be able to receive further down the line. It's going to make it much easier for care professionals or family members to communicate with that person because we know more about them. It's going to be easier for people to understand what I am communicating because they will have down in black and white all about me. Now, this links into another completely free service that we offer called Preparing for Care, which is our advanced care planning platform. Now, you're going to receive some further information about Preparing for Care, not only in your inbox when you're a registered dementia interpreter, but also on your Dementia Interpreters course. Advanced care planning is so important. We need to spread the word about this. Now, I could sit here all day and talk to you guys about all the different levels and all the different opportunities you could get. I'm not going to take up all of your time doing that. When you do your Dementia Interpreters course, when you register on here, you're going to be sent lots of information about all the exciting opportunities that you're going to have access to. This really is different to any other training course that you could ever go on. There's no other training course out there where you will get continuous learning. There's no other training course out there where you can network with a global community that have done the same training you have. And when I say global, I mean global. This is now up and running in America. We are getting American interpreters contributing on the forum. It's going to be up and running in Australia and Canada, hopefully within the next few months. And most excitingly for me, I've been involved with discussions with some people in the Netherlands about trying to get this up and running in the Netherlands as well. And we've not even been going a year. Imagine what our global network is going to look like 2 years down the line. This really does have the power and the potential to transform the world for people living with dementia. Thank you so much for taking the time out of your day to listen to me talk a little bit about the Dementia Interpreters course and the Dementia Dictionary. I hope you've now got a good idea about the course, what it's about, what we're trying to do, and the dictionary as well. I hope you can understand what we're trying to achieve with that project. trying to get people to learn the language of dementia, to take negative behaviours and realise that they're actually positive forms of communication. Just before we finish up, I want to have a quick little chat about some of the other benefits for getting involved with the Dementia Interpreters Course and the Dementia Dictionary. Now, with the Dementia Interpreters Course itself, you've seen how through experiential training, we can give delegates experiences that will change their practice when they're back out at work or when they're supporting their loved ones living with dementia. You've seen with the Dementia Dictionary that we've now got a resource that will put you in contact with dementia interpreters around the world and allow you to share not only what you know, but also what they know. As an organisation, there are going to be so many additional benefits for you about getting involved with the Dementia Interpreters Training and the Dementia Dictionary project. Just imagine, you've got a dozen staff. They've all done the Dementia Interpreters Course. They've all achieved level 3. They've all been sent their Dementia Interpreter badges. You've now got family coming in to view your establishment. They see your staff wearing their Dementia Interpreters badges. You're then able to explain to them that they have done specific training around communication and dementia. They leave your establishment, they go somewhere else, they don't have the badges. The next home they go to, they don't have the badges. Who do you think they're going to choose to support the most important person in their lives? It's going to be you, because you've shown you're committed to making the world a better place for people living with dementia. This is going to help you with recruitment. This is going to help you with retention of staff. This is going to improve the lives of the people you support, which has to be the most important reason for everything that we do. Thank you so much for taking the time to listen to me today. I hope you take this opportunity to get involved with the Dementia Interpreters Training and with the Dementia Dictionary project. You really do have an amazing opportunity here to make the world such a better place for people living with dementia.